For over 25 years, Rotary International has led a campaign to eradicate poliomyelitis. Today, much of the world is free from this crippling disease, but polio is still endemic in some parts of Africa and Asia.
Because it is in first stage only. Sometimes, the vaccine which is not used, when it comes back, maximum it will be in stage 3.
Sunday, November the 13th was National Immunisation Day in India. The Rotary team from UK had travelled to Delhi to assist local Rotarians with the immense task of immunising all the children aged 5 and under in the city. After a short training session, we commenced our work in the corridor of a local hospital where mothers and children were waiting. Having received 2 drops of the oral polio vaccine, the child's little pinky finger was marked with an indelible purple pen to show that the immunisation had been given. When all the young children had been treated, we went with local healthcare workers to some immunisation booths that had been set up nearby to continue the work. The street was vibrant with activity and colour, but our presence soon attracted a large crowd of people, many bringing their young children and babies for immunisation. In the shade, at the entrance to a small dwelling, we were kept very busy, administering the polio drops, marking pinky fingers with purple dye, and rewarding the children with a small gift.
So excited. Yes, exactly. So.
आंटी जी एक फोटो खींचना है।
The local children were full of fun and very keen to pose for our cameras.
Very cute. Very good.
This group of young boys were very proud of the rat they had just caught and were eager to show it to us. Later in the morning, we walked along the street to another immunisation booth. This one was situated in the porch of a small mosque. As the busy street activities continued all around us, another large crowd of people gathered in front of the mosque. The adults were very keen to have their children protected against poliomyelitis.
अंकल से ले ले।
बच्चे बड़े बड़े सब पीछे हो जाओ बच्चे।
चले बड़े बच्चे चलो। मगर मैं पहचानता
The following morning, our Rotary team accompanied healthcare workers to some of the densely populated and impoverished areas of the old city for the mopping up procedure. This involved making door-to-door visits to every house to check whether all the young children had been immunised the previous day. In this slum area, people live in dire poverty. Open sewers run through the streets, and where sanitation is so poor, the polio virus can thrive, making the children very vulnerable. As many of them suffer from diarrheal disease, it is necessary to give them the 2 drops of oral polio vaccine every few months during their first 5 years to ensure that they develop adequate immunity.
ये हमारी कल एक बार दोनों भाई की
Okay. Okay. Thank you.
ये नाखून काट टीवी भाई वो टीवी भाई एक और टीवी में बना देना हाथ में दे दो ना जरा इनको मेरी आंटी
हाँ करो दवाई पियेंगे दवाई।
हाँ गुड
हाँ करो
टीवी में कोई
वैसे बहुत सीनियर डॉक्टर हैं।
मार्कर प्लीज मैम
वो अभी 3 महीने चलो
Thank you.
When a house call has been made, the address of the house is noted and a record made of the number of children in the family and whether or not they have been treated.
Over.
Good boy.
बच्चे को लेके आ रहे हैं
Good girl. Very good. Holding the thumb out ready. Finger out ready. Okay.
Having walked some distance through the narrow, winding alleys of the slums, we emerged onto a wider street where many of the residents were selling fresh vegetables or running small businesses.
Good boy. Good boy. I think the health workers don't know whether they...
फोटो खींच रज्जू आ देख वाह
Thank you very much. Thank you. Thank you.
इसका भी अभी दवाई लेकर आ लग रहा
The healthcare workers met up from time to time to discuss the morning's activities. They all carried official documents in which they had recorded the immunisations that had been given. And these house visiting duties will continue for several more days. Their diligence in doing this work has greatly contributed to the success of the campaign so far.
Thank you.
वो लगा रहे हैं ये बाबना तो नहीं पिएगी ना अभी 3-4 आजा
सुन जब पेट में बच्चा था तब हमारे पास आती थी यहाँ डिस्पेंसरी में जाती थी कहाँ
कहीं नहीं जाती एक भी टीका नहीं लगाती कहते मैं दुखी हो गई
बच्चे 1.5 महीने हो गए
Thank you. Good morning, gracias.
ये अच्छा गुड़ बनता है ये नाई काटता अच्छी
Thank you.
हाँ बिल्कुल